As we live longer and the population ages, more and more families will be faced with the decisions about how to provide the best care for their loved ones. I'm Dr. Freda Lewis-Hall, Chief Medical Officer of Pfizer, and I'm here today with award-winning actors Jill Eikenberry and Michael Tucker to talk about the decisions that they've made with their family and caring for their loved ones. So thank you so much for coming. Welcome, welcome.
Delighted to be here, thanks.
Jill, let me start with you. I know that your mother, your family provided care for your mother, and that she had a diagnosis of dementia, and that led to a lot of things for you and your family to come to grips with. Can you talk a little bit about how she came to that diagnosis and what some of those early decisions were like?
Yeah, it was, as often the case, it was a difficult road because we were all in denial about the situation. My mom was starting to show signs of dementia, and I didn't want to see them. So when my mother's husband died at 91, and she started falling, and she started slipping farther and farther at quite a precipitous pace into dementia, you know, it was still very hard for me to say this is what's happening. I've talked to a lot of people who I think get to the same point. Mm-hmm. And we brought her back and established her in a retirement community with assisted care facility.
Now, had you come to grips with the fact that she had a diagnosis of dementia yet, or were you bringing her close so that you could kind of watch her more closely but still didn't think she had dementia?
I was bringing her close so that she had a place where I could see her more frequently, but I still envisioned that we were going to be able to go to the matinee on Sunday, of the theater, whatever, and go to the Metropolitan for lunch, and I still had this idea about what I was going to be able to do with my mother.
She was going to snap back.
Yeah, yeah. And in fact, I did not sign up for the 24-hour care in the assisted care facility because I didn't think she needed it. And very quickly it became clear that I was wrong.
And as you were watching kind of all of this unfold, were you also in denial, or were you kind of a little clearer earlier about what was happening?
I was a little clearer earlier, but I didn't know what my job was. You know, was my job to say, snap out of it, this is the truth, and be sort of hard about it? Or was my job just to help her in her denial, in a sense? And I walked that line. You know, I was there to support her. It really was a caretaker who turned it all around. This wonderful, brilliant Jamaican woman who accepted Jill's mom for what she was then, and never knew her as the intellectual and the political activist and this very brilliant woman. She didn't know that woman. She just knew this woman, and she loved that woman. And because of Marcia, her name is Marcia, because of that, Jill's mom finally let go and stopped trying to pretend that she was what she was before.
When we made the decision to get my mother out of the the assisted care facility and bring her home, essentially, which was an apartment across the hall from us with full-time care, with her stuff all around her, she became much less agitated. She became quite calm and seemed to really enjoy a lot of things. And she seemed to love having us all around her, and she knew us and wanted us to be there. So it became a blessing.
Let's talk a little bit more about the two of you. How did this affect your relationship, the way that you talk to each other, the way that you handled things? You mentioned you weren't even sure what your role was at first in this caregiving thing.
I'm still not sure. I'm just confused all the time. It brought us closer together. We had it was a difficult thing because I gave myself the job of making sure that our life didn't suffer too terribly because of this situation. And so I was cheerleading for our life, while Jill was very staunchly cheerleading to take care of her mom. And I think the answer that we finally came up with is that you do both. You can't give up your life and you must take care of your parent. So you do both, and you sort of take turns.
And I'm sure that you learned many very important lessons, but if you had to impart one, if there was kind of one thing that you think everyone should know, what would that be?
I think this thing about letting someone else, if you can, finding someone good who can be the caretaker or caretakers so that you can be the daughter or the son or the sister or the spouse. And not have to do both, because if I had to do all the hands-on caretaking, it would have been very hard for me to have the really wonderful last 5 years in many ways that I had with my mother.
And what about you? I'm sure there were many lessons for you as well. What would be your one?
Talk to people. Just keep talking to people who have a similar situation, who have had one in the past. Talk to each other, talk to your kids. Just get everything up and out, and don't suppress your feelings, and don't suppress your worries and your doubts. They disappear if you talk about them.